Welcome to the medical news on the SBTN show from Washington, D.C. On this edition of Medical News, we will talk about osteoporosis and the new medication. Osteoporosis is a silent disease and is a major public health threat for 44 million Americans, 68% whom are women, especially among women in Asia. Here with us today is Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will talk with us about the osteoporosis disease and the new medication based on the current information. Welcome to our show, Dr. Tran.
Yes, welcome to the medical news today, and welcome, Ms. Lam.
Thank you. Sir, today we're going to talk about the osteoporosis disease. First of all, can you explain to our audience what a osteoporosis disease is?
Well, basically, osteoporosis means soft bone or porous bone, but because we may have different definitions of osteoporosis, but the National Institute of Health consensus define the osteoporosis is a skeletal disorders, meaning the disease of the bone, and reflect the integration of the bone density and bone quality. The bone densities mean the compact part of the bone, and the quality mean the structures and the minerals and all the collagen fibers of the bone. Now, the bone density and the bone quality depend on two different cells in the bone throughout our lives. The first one is osteoclast. The function of osteoclast is to remove the old bone, to replace by the new bone. And the osteoblast, the function is to form a new bone. So throughout the year, the bone is always not the same, but keep changing and keep remodeling. Until we get older and older, then the function of these cells decrease. And we have different other factors as well affecting these cells. And we have the disease called osteoporosis. I mean, the function of these cells is not really like before.
So osteoporosis is on the rise in the world, especially in the Asia country. Can you tell us what the risk factors or causes that are linked to the development of this disease?
Yes, the risk factors is really just multiple risk factors. Number one, everybody aware and know it because of the aging that create a problem both for ladies and for men. But they also recognize that people very low weight, less than 127 pounds, also have risk of having osteoporosis. And also people not using hormone therapy, especially lady, when they have the surgery, remove the ovary, they need to have the hormone replacement. If they really don't take these hormones, they run to the risk of having osteoporosis. Or people not really exercising, and people drinking a lot of alcohol and smoking a lot. It's also these risk factors. But lately, most of the experts recognize that people with low calcium and low vitamin D also develop risk factor for osteoporosis. And then certain kind of medication also contribute to that part. As the first one is corticosteroid, usually to treat asthma and different kind of arthritis, and also maybe trigger soft bone. And then the Dilantin usually to treat seizure disorders. People have to take for a long time, also develop soft bone. And people with chronic renal failure also may have the same status of soft bone later in life. So these are the risk factors, really multiple risk factors. Yeah.
So osteoporosis is often called a silent disease because the bone loss occurs without symptom. Are there any ways you can describe the symptom or the signs of this disease?
Yes, usually we call silence because so many years people may not recognize that they have soft bone until something really suddenly happened when they fell down and they got the fractures, or they just notice they have certain back pain or bone pain somewhere, just minor injuries and like coughing. They also develop severe pain in the back. That means people have very soft bone and osteoporosis. And secondly, is if they don't have any symptom, they don't recognize that they get shorter. Yeah, they get shorter, and the back is really curved a little bit. And then finally, when they get older and older, they really have the stoop posture. In medical term, we call kyphosis. When that happens, you can see on the pictures on the screen, when that happens with the kyphosis, people losing at least 6 inches in their height. So that's really, these are symptoms, either back pain, no symptom, or losing their height, or the back get curved and develop some kind of kyphosis. These are the symptoms of osteoporosis you can see throughout the years.
So beside all the signs that you just mentioned above, how can a patient know for sure he or she has osteoporosis, or how a diagnosis of osteoporosis is made so the person can treat medical treatments?
Yes, it's for the diagnosis. Really, most of the physicians based on the symptoms, based on the acute fractures developed in elderly people, and they use the regular X-ray. They can recognize some kind of very thin or losing bone in the bone of the fracture site. But most recently, and they develop more testing. They try to figure out whether the patient may have low calcium, low vitamin D, and have the other disease like thyroid disease or the other disease that may affecting the bone. And especially men, the amount of testosterone, if low, is also trigger the risk of fractures. But with the advance in technology, we have the technology we call DEXA scan. DEXA scan really to measure really bone density. And the way they measure it, they measure the bone of the lumbar spine and the hip area, and then they compare the density of the bone with a group of normal people, young group, to say the norm. And if the result far away from the norm, we call deviations, we call standard deviation. If that result far away from the normal bone, then we call really soft bone or osteoporosis. If more than -1 to -2.5, we call osteopenia. That's been already soft. But to go beyond -2.5, then osteoporosis. So right now we have the tool to define exactly what kind of bone density the people have and help the physician to decide which group of people need to be treated.
So before we discuss further on the uses of the medication for treatment, can you tell us, are there any other kind of treatments for this disease? For example, the nutrition or the exercising might help?
Yes, it's very important. Before we're talking about medication, we're talking about the exercise, about the nutrition, and how to prevent the fall from the elderly people. For exercise, really, we define the exercise like called weight-bearing exercise. What that means is not regular exercise like regular walking, but we have to do a little bit walk faster and do a little bit exercise and carry some weight, or do a little bit small weight lifting, jumping rope, or doing a little bit of exercise to stimulate the bone. That's what we need is the weight-bearing exercise. Now the other one is nutrition. Nutrition need calcium and vitamin D, besides protein and other vitamins. But the bone really require enough calcium and vitamin D. And thirdly, for the elderly people, what's very important to prevent them from falling down, because anything is trigger the fall may trigger the fractures, and the fractures can cause mortality in elderly people, especially fractures of the lumbar spine or fractures of the hip. That's how the people die, because they develop complication from fractures. They stay in bed, and it's really sometimes difficult to treat nowadays.
Okay. So now let's talk about the medication for osteoporosis. How many kind of medication right now, and what are the newest medications?
The medication throughout the year, we have so many different medication. But basically, the first group of the medication we call estrogen. That's a hormone for ladies, because we know that ladies usually get the soft bone sooner than other group, and we try to use that to treat people with the osteoporosis, and really work and helping to prevent the fractures. But then after so many years, we notice the estrogen can cause a little bit side effects, triggers maybe increase the risk of stroke, increase the risk of having the clots in the veins, and especially increase the risk of cancers of the uterus and the breast. So right now we use much less the estrogen than before. And to replace the estrogen, we have EVISTA, a new form of estrogen-like that may affecting the bone as well, but really the effectiveness of that medication is also low. The only is to avoid the cancers of the breast. And then we're talking about the calcium and vitamin D. Therefore, we need at least 1,200 milligram calcium and 800 international unit of vitamin D to get enough to reduce the risk of fractures and build up the densities of the bone. And then we go with the medication. Right now we have so many medication, and I think is the first group is biphosphonate, and you don't need to remember these medication, but really right now on the market, the three medication that are well known for everybody is just Actonel, taking orally, and Boniva, also taking orally once a month, and then the Fosamax taking once a week. But some people may develop side effect. They couldn't take the oral medication, so we have the nasal form of the treatment they call calcitonin nasals. And for people with acute fractures, we have to use different approach. We have to give shot every day to build up the bone density quicker, and usually we get the results in maybe in about 3 months. These are the medication currently used, but recently we have the newest one medication they call Reclass, that only give like once a year. This is amazing. This is breakthrough medicine, because we never had that kind of medicine that we use just once a year and able to protect the bone. But the studies show that may help to prevent the fractures and also build up the bone density as well.
So how long does a patient have to be treated, and what are the side effects of this medication?
Yes, that's the question. Is very important. First, we need to know that any medication has some side effects, and after we use many years now, we notice is the biphosphonate, the medication we take orally, estrogen have side effects. These Actonel, Fosamax, Boniva also some side effects, especially the esophagus and the stomach. That's why when you take this medication, you're not allowed to go back to bed. You have to keep moving and take before you take the breakfast, about half an hour. Even though try to prevent like that, but most people may develop side effect and couldn't take anymore. The second group is complication is sometimes people develop some kind of severe muscle pain and low calcium. And the most recently, the dentists and most the people do work on the dental part of the body. They notice is when they remove the bone and try to fix the jaw, they have to deal with some person that really very soft bone and take a medication and could not heal very well. And we call that is osteonecrosis. Also mean bone. Necrosis means it cannot really destroy the bone and cannot forming the new one, and take a lot of time and difficult to treat these. These are the very complication, but it's not happen all the time. Just happen about 1 over 10,000 cases. So hopefully we don't have to deal with that in the future. Usually what happens in people using IV medications to treat people with cancer and soft bone, things like that.
So how long does a patient have to be treated?
The question is right now still debatable, because we don't know how much we can keep the medication and how can prevent the complication or side effect down the road. So we now, the step is to monitor the bone density every 2 years If the bone density is very close to normal, we can stop the medication and find people with exercise, taking calcium and exposed to the sun and things like that to avoid long-term complication.
So,
and hopefully we have new medication will come out very soon.
So how can we prevent this osteoporosis disease, sir?
Yeah, to prevent that is very simple. Exercise, weight bearing, means it's about a little bit more heavy than normal, and take enough calcium and vitamin D, exposed to the sun, and then this try to prevent from falling from the people who really get old, or people we have to taking care of them, like nursing home, at home. And then finally, check the bone density. It's very important when you get to the age of 50. Better to get the baseline bone density to know exactly where we stand on terms of the bone density, and to either to prevent it, treat it, or get advice from the experts.
Thank you, sir. Before we close the show, can you give our audience some advice on the osteoporosis disease?
The advice is exercise, take enough calcium, vitamin D, prevent from falling, and check the bone density. I think that's the best advice for the audience, and I think it's just try just simple like that. Yeah.
Thank you, Dr. Tran, for being with us today.
Yeah, thank you for listening to us today, and also again thank you, Mr. Tu.
Thank you, sir. That was Dr. Sang Tran, who just shared with us information on the silent disease, osteoporosis, and the new medication. We hope that the information provided by Dr. Tran had shed more light on the disease. That is all the time we have on this edition of Medical News. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the Medical News Show.